The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to the webinar for the guidance for reporting semi-annual and submitting TPP performance measures. This webinar will be recorded and available for later viewing with a link. As well, there are some handouts in the handouts widget, and if you have any questions as we go, please feel free to type them into the questions widget, and we will be able to respond to those as well as post the answers for everyone. We'll give just another moment for everyone to continue arriving and coming in, and then we'll go ahead and get started. Thank you, everyone. Once again, welcome to the Semi-Annual Reporting and Submitting TPP Performance Measures webinar. We're going to get started in just a minute. Here in GoToWebinar, you can submit questions to the question widget, and the answers will be posted there. There are handouts that include the user guide as well as the section data tracker or attendance tracker. And you are also able, if you would like to ask a question out loud, use the raise your hand function in order to indicate to the staff that you'd like to be unmuted to speak your question instead of type it into the widget. We're going to go ahead and get started now. So I'll go ahead and hand it over to Jacqueline Ruiz to begin our presentation.
Thank you. Oh, excuse me. Hi, everyone. This is Jacqueline Ruiz, the team lead that oversees the Teen Pregnancy Prevention Grant Program. So thank you all for joining us. Just a little bit about what to expect today is we will talk a little bit about the guidance that was just posted on Connect for the semi-annual progress report. And then we have our contractor here to talk through the performance measures website and how you can use that website to submit your performance measures. Yeah, you can go on to the next slide, no worries. So just a reminder of the requirements which you'll find in your notice of award. The performance measures are a set of measures that you are required to collect and report to us on a semi-annual basis. And they are due at the same time as your, what our Office of Grants Management would call performance project reports. So for us, we just call that the semi-annual progress report. Your semi-annual progress report is due 30 days after the end of each reporting period. And we do provide additional guidance to sort of help you understand what information we will be collecting as part of that semi-annual progress report, which is what we'll go over today. And then those reports are required to be submitted electronically through the performance project report, what we call the PPR module in Grant Solutions. You can go on to the next slide. So on connect.gov, what you can find is guidance specific to the semi-annual progress report. In that guidance, you can find submission instructions. So essentially, when do you need to submit your report? Where do you submit your report? Content, which is what needs to be covered by that report. And then we do offer an optional template that can be used by grantees to essentially complete all that information. And then finally on connect.gov, you could also find what the performance measures are, and we did develop some supporting guidance that just helps provide definitions for performance measures, some frequently asked questions that we oftentimes receive with some answers. And then we did also, as a reminder, and I can't remember when we did it, but a few weeks ago, I want to say, maybe it's been a month now, we did have a webinar to sort of go through the performance measures, and so all of that is linked on connect.gov. So just for the submission instructions, your SAPR, so I'm going to call the semi-annual progress report a SAPR just because it's a lot easier for us to use that term, and then your performance measures data, all of that must be received by OPA no later than 11 p.m. Eastern time on the due date that you will see on the first page. And so for your first reporting period, that is January 30th. Your SAPR must be submitted using that performance progress report module that you find on Grant Solutions. Just a note that there is limits to that PPR module. And then your performance measures data should be submitted using the OPA Adolescent Health Performance Measures Data System on that website that you see there. It's okay, next slide. So just a little bit about formatting for your report. So for your SAPR, we do expect you to address all the NOFO expectations, and we'll talk a little bit about what that looks like in a little bit. Please be sure to properly label all your sections. As I said, we do have an optional template that you can use. If you don't want to use the template, that's perfectly fine. We just want to make sure that you are identifying the expectations clearly and all the sort of different components of the SAPR that we're asking for. Make sure that you're concise but complete, and so we'll talk a little bit more about that in a minute. Use 12-point fonts. A few of us are on, I'll say for myself, on the older side, and very small fonts is not helpful, so please use 12-point font. Make sure you include your grant number on the submission, and then please keep your report limited to no more than 15 pages. You can include appendices. These are optional. We'll talk a little bit more about that as well. So in your report, what we'll ask for you is to talk about each expectation, and in each expectation, identify whether you are meeting that expectation, if that expectation is in progress, which means you're working toward meeting the expectation at this time, but you're still sort of having a lot of work being done around it, or not meeting. So you haven't made any meaningful progress toward that expectation. We'll ask for a narrative description of, in addition to sort of this status, what has been the progress that you've made in these past 6 months towards meeting that expectation, and any activities related to that expectation. Talk about what barriers or challenges you've encountered, as well as, how you may have been able to overcome those barriers or plans for overcoming them. And then definitely a section around just what are your overall key accomplishments and successes that maybe you weren't able to sort of fit in any particular expectation. We also want to just confirm through that report that any relevant documents that need to be on connect.gov are on connect.gov, and you can follow up with your project officer in case you have any questions about that. We do expect to release the grantee profile form on Connect around mid-December. And so during that time, we'll just ask you to please go into the form and make sure it's updated and that all the information is accurate. And then making sure the contact form is up to date and accurate as well. Really, every 6 months, these progress reports are an opportunity for you to go into Connect and make sure all the information that we have about you is up to date and accurate, because we do actually use that information, I promise you. We pull it for the Grantee Digest. We get several data calls from Congress asking about grantees working in one space with one population, all that kind of stuff. And we really use the profiles and the contact form to help get that information out. So how do we use the SAPR and the performance measures data? So just a little bit about the process is, once you submit your semi-annual progress report and your performance measures, the project officer does what is called a technical review using a form on connect.gov that we'll sort of talk about at a later time. Once we're done with a technical review, that form is shared with the grantee for a formal response. And so that response is due within 30 days of receiving your technical review. And then once you have your formal response, there's been a nice sort of meeting with your project officer to discuss the technical review and your responses. That completed form will be uploaded into Grant Solutions as a grant note by your project officer. How we use the technical review data, because that's really what's helpful, is we use it to identify areas for training and technical assistance, whether it be specific to your grant or maybe sort of systemic issues that we're seeing across all grantees where we think it would it would be beneficial for a webinar, a toolkit, maybe a tip sheet type of thing. We also use it to lift up best practices. We've heard time and time again that y'all are each other's best resource. And so you can imagine as we're reading your reports that if we see someone's excelling in engaging parents, that's a person we can sort of lift up and identify as a good resource for other grantees. And then we use it as an area for improvement for ourselves. So if the guidance, if any guidance you've been receiving hasn't been clear, if the guidance for the progress report itself hasn't been clear, if we're seeing that there's an ongoing issue that looks like it could be something based on information we've shared, it's just an opportunity to make sure that we're being clear about our expectations so that you are sort of at your best place to be able to meet those expectations. And so just some reminders and tips. So the semi-annual progress report is really your primary opportunity to memorialize your progress in meeting grant expectations. It provides context to the performance measures data, right? It is your story that you get to tell of what's happened in the last 6 months. What I would also advise is that you sort of think about, it is a delicate balance between giving enough detail for someone to understand what has been happening in your project for the last 6 months. And a suggestion I always give is do not make assumptions of what people know, sort of tell that story. But you have to balance that with that 15-page limit, right? Your project officers, I'll give one example. Our lovely project officer, Tammy, has 16 grantees. So if there's very lengthy novels being submitted in a semi-annual progress report, you can imagine how time-consuming that might be for her to get through all of that and be able to provide you with the resources and support that you need to make it meaningful. So really balance sort of detail with being concise, providing us with the facts and avoiding that fluff so you can get it within the 15-page limit. We do also understand that this is, oh, sorry, go back one more time. Sorry, this is your first year. This is year one. This is a planning period. You know, I hope you understand that we obviously know that there'll be some grace given in terms of thinking about the extent to which you're meeting expectations. And so if you're not meeting an expectation, that might be okay, right? You're in a planning period. It's a lot that you're having to cover. And so you just need to make sure you share that story as to what is happening, but why is that happening? And it's a great starting point for a conversation with your project officer as well. And then finally, I just want to plug the RHNTC does have a helpful resource that can be shared, and I don't know, we'll see if we can put it into the chat somehow. But they do have a wonderful resource that can help in thinking about your report development, and so we'll make sure to put that in the chat at some point in this webinar, and if not, make sure to highlight it on connect.gov so you guys have easy access to it. Okay, sorry, next slide. So the next few slides are actually going to be just some sort of, you can go back one more. Sorry, there you go. We just thought it might be helpful to sort of identify some helpful prompts. We get a lot of questions from grantees about like, well, what do we talk about? Like, what level of detail do you want? What information do you want to hear? And so I think I have like 3 slides that just provide some helpful prompts. But just a reminder that for each expectation, you really should be highlighting like what has worked and any lessons learned. I think a lot of times grantees are scared to talk about, you know, quote unquote failure, but failure is an opportunity to identify what didn't work and what you plan on changing as a result of it and like how it might lead to a success further on in your project. So don't shy away from talking about your successes, but also your challenges and what you've learned from those challenges, and identifying opportunities that you might need for further TA and support from your project officer in the report. So for project management, thinking about sort of what processes and plans have you established, who's been hired, who's left to hire, you know, what's going on with your hiring practices. How have you been sharing information about your project? So do you have a website? Did you publish a press release? For areas of greatest need and facing significant disparities, thinking about sort of telling the story about what efforts you've taken to date to revisit and update your initial needs assessment, who was involved, what stakeholders were engaged in this process, and did anything change, or did things remain the same? Sort of like what was the aha moment of your needs assessment? for ensuring equitable, safe, supportive, and inclusive environments, talking through what efforts have you taken so far to ensure that the project is being offered in this kind of environment. For replicating to scale evidence-based teen pregnancy prevention programs. I know a lot of folks think about this one a lot because it's tied to reach, it's tied to setting, it's tied to a lot. So it's your planning period. We don't expect that many people have started implementation. If you have, absolutely tell us the story. Let us know how that's been going. But in this first 6 months, we're thinking your story might have a lot more to do with how you went about selecting an EBP, what final decisions were made and why, if there are adaptations that you have proposed, you know, and have been able to start implementing because they were either minor or they were approved major adaptations. How has that gone so far? Is it meeting the needs of the population as you intended it to be? What adjustments have you had to make to implementation? If you have started implementing, you know, what's the status of scaling EBPs? Again, some of these questions maybe might not be very relevant for some in the first 6 months. What outreach have you done to at least promote this idea of scaling? Maybe what partnerships or what implementation sites have been reached out to, and how are you being representative of the 3 different settings? That's the expectation of the NOFO. You can go to the next page. For adolescent-friendly supportive services, thinking about what efforts you've taken to sort of start the development of a diverse multi-sector network of partners and how those are addressing the needs of your population of focus. What processes or protocols have you developed to connect youth and their families, or maybe to what extent have you explored processes and protocols or building the capacity of youth and their families to sort of navigate systems? And think about those same questions as it relates to healthcare providers and settings, like if there's any strategies you've explored with how you might be able to improve access to adolescent-friendly services in your community. For materials review, this is definitely an opportunity for you to provide so much wonderful depth to your materials review process. But what was that process? Like, who was engaged as part of that? What changes did you make as a result of it? And how were these changes communicated to make sure everybody is implementing or communicating or disseminating in a way that's age appropriate, medically accurate, trauma informed, and all those? For meaningful youth engagement, you know, how have youth already been engaged in a meaningful way during the planning period? What strategies have you explored or even implemented to meaningfully engage youth? You can go on to the next slide. For parent engagement and even community engagement, same questions, right? What strategies have you explored or implemented to meet these expectations? For overall community engagement, are there any partnerships or coalitions that you've been exploring, or maybe you've started to develop, or you already have in place and are leveraging to mobilize your resources in the community? And then finally, for monitor and improve, what is the status of your monitoring improvement plan? We know we released that guidance late, and so you're still in that process. That deadline has been extended, but talk a little bit about what's already been done. Have you identified your evaluator? Do you have a team put together that's going to focus on monitoring improvement for the project? What has been the process for developing your plan, or what work has been done already to do that? What data have you utilized? And, you know, are there any data you've already used as for folks who are implementing early? Has there been already any data that's been used to sort of inform your professional development and capacity building or your implementation? And what adjustments and improvements have you made as a result of that data? And then just finally, to summarize before I hand it over to Tara to talk more about the performance measures website, is your reporting period for this first semi-annual progress report covers July 1 to December 31st, and that the SAPR and the performance measures are due January 30th. Your performance measures are due via that website that you see right in front of you. And then the semi-annual progress report, which is that narrative report, is to be submitted on Grant Solutions through the Performance Progress Report module. Just a note that if you are having technical issues with the PPR module, definitely first reach out to the help desk, the Grant Solutions help desk. If that doesn't resolve your issue, please make sure to reach out to your grants management specialist and CC your project officer. So I just want to put that plug in. And with that, I'm going to hand it over to Tara to talk more about the performance measures website.
Thank you, Jacqueline. Hello, everyone. I'm Tara Rice, and I am a public health advisor in the Division of Research and Evaluation at OPA. So welcome to all of the TPP 23 Tier 1 grantees. We're now going to move into the next portion of this presentation to talk about how you report your performance measures to OPA. And this is going to be using a system that has the website link OAHPMDS. This is our Adolescent Health Performance Measures database, and we have a contract team from WRMA who runs that system on behalf of OPA. And so we will now have the WRMA team talk to you about how to use the system to submit your performance measures data to OPA. So I'm going to turn it over to Zach now.
Thank you very much. I think before we continue, actually, I see there might be one question here from Carrie Johnson. Maybe we can see if we can address. Do grantees need to meet the number of participants expected to be reached in the first year, or is grace given for this due to the 6-month planning period? What advice do you have for programs about reach in the first year?
That is a great question, and a question that comes up very often. It's a challenge for me to answer that question because on the one hand, y'all identified your reach, right? We didn't give any sort of prescription about what reach needed to look like across the year, other than to sort of give that historical funding table that says like, hey, like for the most part, people who ask for this amount of money were able to serve this amount of youth. So I would say that if you are anticipating reach being an issue for you in year one based on what you had proposed in your application, the narrative is very important to talk about what have been the challenges or issues that have come up, and sort of not only just that, but then talking about for future, right? Like, for example, if you estimated you're going to serve 1,000 kids in this first year, and for one reason or another, challenge, right? A partner backed out, a community wasn't quite ready, whatever the reason is, sort of sharing that story and sharing that concern that happened, and then talking about what are your plans for the future to sort of overcome these challenges. Implementation's hard, and some of the stuff that grantees face are not predictable, right? COVID-19 was a great reminder of that, and hopefully that doesn't happen again. But there are things that happen every day in our communities that can prevent us from implementing, and that's an important story to tell. But then there are things that are within our sphere of control. So if a partner backs out, how can you identify a new partner? If there's a readiness issue in your community, how can you support the community to better understand what the issues are and meet their needs in a way that satisfies this grant? So the narrative is very important to providing that story. But you're right, it is a year one. And so what we really focus on in year one is hearing your story and understanding and identifying what TA may be needed to get you on track for years 2 through 5. So I hope that answered your question, Carrie.
Wonderful. It looks like we had another few questions come in. Maybe we'll do just a few more and then we'll move on, and we can come back if there are any remaining. So let's take a look here. We'll start with from Donna. If we submitted details of our materials review, submitted it to OPA, and received approval, do we have to spell it out again in our progress report?
Yeah, if you've already shared the details in a document, I would just make sure that document either is in connect.gov or Grant Solutions. Follow up with your project officer about the best place to put that, and then you could just refer to that. I would make sure to acknowledge it in your semi-annual progress report, and I say that only because, you know, I love all of my project officers. I hope they never leave us, But God forbid Jackie decides tomorrow that she's had enough with this office and she is just going to retire. Somebody's going to read your report that has absolutely no context in what's going on. So it's always helpful to not assume that people know. But if it already lives somewhere, you could always refer to it. You could say, yeah, we did this measure. We've talked about it with our project officer. More details can be found on this report. And that's fine, especially if you know that your project officer has already engaged you in that conversation.
Wonderful, thank you. All right, we'll do one more, I believe. If an organization provides a resource guide to participants that covers all applicable service categories, is it okay to check off that they were referred from Adela?
I'm going to have to defer that one to your project officer to talk to them about that. And I say all that because maybe that's okay for year one, but we might want to push you out of your comfort zone and think about how you can maybe go a little bit beyond that in years 2, 3, 4, 5. So talk to your project officer about that. And that's probably the most helpful response I can give.
Wonderful, thank you. All right, so I'll go ahead and move on to talking about OAHPMDS, OAHPMdata.net. And I see there are one or two questions that might pertain to that, so we'll get through some of this, and then we'll take a look back at the questions and see if there are any additional or continuing. So this is the OAHPM data support team, our help desk technical assistance team, who run and maintain the website and respond to your technical assistance emails that you send to us, support@ohpmdata.net. I'm Zach, and we have our wonderful team here. I don't think we're planning on doing full introductions, so we'll keep moving forward. Our agenda for this particular portion is we're just going to take a look, an overview of the performance measures. We can kind of walk through those, as it sounds like we've already recently had kind of a session on what those are. Then we'll take a look at getting onto the website itself, the grantee administrator users and their initial setup, data collection tools that we provide alongside the website, and then going about the data submission for the grantee data, the section data, and the supportive services referrals that you've made. We'll just mention some of the extra website features, and then we'll get to like a full questions and answers for the end of the full webinar. All right. So the OAHPMData.net allows online data entry of your TPP performance measures. It validates your data that you enter to make sure that it meets the criteria that are necessary, required, or within a certain range. And then you will be able to review reports of your data once it's all entered and aggregated. There are two types of users on our system. We have our grantee administrators. So this might be the project director or the evaluator. This is someone who is in charge of setting up things for the grantee. They'll enter the grantee level data, which is reported every 6 months at that grantee level. And they will set up the implementing organizations so that it can identify which organizations under them are implementing programming. Even if the grantee is implementing the programming themselves, they'll still want to identify themselves as an implementing organization so that they can identify, who ran that particular program model. Here we have our reporting schedule. Every 6 months we'll be in the system. Grantee data is technically reported on that semi-annual reporting period, whereas section data we kind of look at a whole year, but you'll still report it every 6 months, however many sections are completed. So again, we have our grantee level data. For the tier 1, it's going to be sustainability, fidelity and training, engagement, and dissemination. For the organization level data, that's going to be your section data. So when you've implemented programming and you want to record like how many participants and the attendance percentages. So the section data, each section has a location, state, and urbanicity. You'll report the reach, the dosage, and the fidelity and quality measures. And then finally, the supportive services data are also linked to the particular organization that did the referral on that level. And we'll go ahead and go back through, as we do a demo through the website, each of these pieces. So just a quick refresher, a section is, let's say, like a continual series or whatever the program model dictates. A section can be made up of many sessions, which would be an individual meeting of that group. So you might have a section that has 8 individual sessions that you've planned for, and you're reporting the different things about those sessions, like the attendance for all 8. This last term, activities, refers to the fidelity of activities completed to activities planned within each particular session. These slides will be available, as well as we have a glossary in the back of the user guide if there are any terms or things about the performance measures that we want to take a little more time to look at. But today I want to focus on the tools and templates and the website so you can kind of get a sense of what that looks like. So our tools and templates that we offer, you can download these from our resources section. We have the fidelity process form. This is part of your grantee level data that you'll submit every 6 months. It gives you a score between 0 and 26. We have the program observation form. This is the form that someone would actually use while they're observing the class to score it. And at the end of the session, the last question asks for a final score. Finally, the section data tracker. This is an optional tool that we provide. If you need a way to track attendance that will also go ahead and calculate the percentages for you, you can also record your observations and observation scores alongside it, and it'll average all those scores for you on the reporting tabs of this Excel worksheet to make it a little easier to report if you want to use this as an attendance tracker for your particular section. If you track your attendance data for your programs in a different way, that's okay. You don't need to use the section data tracker. It's just there if you need a system to use. All right. So the data collection website itself, we have, again, the 2 types of users. First is the grantee administrators. So shortly after this webinar concludes, we're going to go ahead and anyone who does not already have an account will have an account created for them, linked to the grantee that we have for you. It's going to be grantee directors and evaluators that will receive the initial wave of accounts. And if you need any additional accounts, you can contact the help desk to be connected. You'll want to CC your grantee director or have them send the message for you to let us know that we need to create an additional grantee administrator account for this person's email for that grantee. If you already have an account because you are part of a TPP 2020 grantee, let's say, you will not receive a new email, but by this time tomorrow, when you log into the system, when you look at your list of available grantees to enter data for, you will find the new 2023 grantee added to your list of available grantees. Hopefully that addresses our question here from Annie. If you used to have an account for a previously funded period, then your username and ID will still be the exact same. If you haven't logged in a while, you may need to use the forgot password function, or you may need to contact the help desk if you haven't logged in within about 6 months or more. I think it is. Your account may have been deactivated, so you'll need to contact the help desk to have that reactivated. All right. So for the grantee administrators, they're responsible for maintaining and submitting the grantee data, the grantee level information, and they're also responsible for maintaining and updating the information about your implementing organizations. So creating them, assigning program models, and assigning users. So for their initial setup, when you first go in as a grantee administrator, you want to do some things like make sure your grantee primary contact information is correct. That'll be under the edit button. You'll want to add your implementing organizations. So if you know your grantee is implementing programming, or you have 3 or 4 partner organizations implementing the programming, you'll go ahead and create those by giving them a name and assigning them the program models that they're going to be running. The list of available program models is from the approved list. If for some reason you know you have an approved model that is not on the list, you'll want to contact the support desk as well as your PO together, and we'll get that sorted and added for you as appropriate. Lastly, you'll need to assign or create users that will be entering the section data for that implementing organization. So as a grantee administrator, you are able to enter data for any organization, any level of data. But for example, if you have an evaluator who is only entering section data for 1 or more organizations, and they don't need to enter any grantee data, then you can go ahead and create an account for them or assign them as a user to that implementing organization only. Then they won't have access to grantee level data. They'll only be able to enter data for the sections that they're concerned with. All right. Let's see if there are any additional questions. So we have a question from Michael. If a staff with an account has exited the organization, can their account be transferred? And the answer is it won't be transferred. More so, you'll contact the help desk, probably CC your project officer, and then we'd be happy to create a new account for the new person and deactivate the account for the old person. There's no limit on the number of accounts. You know, we probably don't want like 20 people to have an account if you don't have that much data to enter. But we do recommend that there be at least 2 grantee administrators, just so there's at least 1 extra person in there to help out or create users or whatever's needed. Okay. So again, we have our grantee level data. That's going to be those performance measures for sustainability with partners and funding, fidelity and training, your engagement with stakeholders, and your dissemination through manuscripts or presentations, conferences. The website provides data validation stuff, as in making sure you've submitted required data, so it won't let you leave some fields blank, and allowed value ranges for things like fidelity that has to be at that score between 0 and 26. For our section data submission, we have our section that's created as with a reporting period and program model, state, setting, and urbanicity. Those together identify a single section, and then you'll submit data for that section, such as the reach to participants with their demographics, the dosage of their attendance data, and then the fidelity and quality. Did you follow the program model? And if this session was observed, what is the average quality score for all observed sessions? And again, we have data validations on those to make sure that the required data is needed, allowed value ranges, and that things like the demographics total correctly to the total that has been indicated for each type. So in just a moment, I'm going to go ahead and pull up the website itself so we can take a look at it together and just kind of walk through the data entry process, the setup. Give a moment to see if there's any questions as I pull up. All right. So I see one question here that asks, will it be possible to upload section data as CSV files for TPP 23? And the answer to that is yes. We do have the import function. This is going to be only for section data for the TPP 2023s. You can see here we have our link for imports, and the resources such as the user guide will provide instructions on how to complete that template for uploading that data. And also there's a download of the CSV template itself to upload that data. So for example, if you have 100 sections worth of data, and you think that doing it through the website itself physically is going to be a lot of clicking and numbers, and it would be easier to set that up on a spreadsheet for you, you can do that. It will take more time on the front end in order to make sure that your Excel spreadsheet follows all the validation rules that is required. But you are able to do that and upload it. Sorry about that. Hopefully everyone is seeing the correct screen now. Here we are on the welcome page of the website. This is the test version of the website, so you will not see the normal things that you'll see. Normally we have a little bit more welcome text, and then we post announcements to the front page occasionally about data reporting, due dates, and other important items that you may want to know about. So if you do see an announcement on the home page that's new since the last time you've checked, please make sure you read through those, as they could contain important information. So as a grantee administrator, when we come in here, we're going to see these options in our navigation bar. The important one up here at the top we're going to take a look at is grantees. It'll take us to the Manage Grantees page. And here we're going to see listed all the grantees that our account is associated with. So you can see I have kind of one of each, as well as a grantee from the last cohort of TPP 2020. So if you're a previous user, you will still see those old grantees online. When you come in as the grantee admin for the first time, we'll ask that you go ahead and check this edit button right here and maybe fill in the primary contact information so that if there's any issues and we need to contact somebody about the data on the website, we have, the person we should go to first should go here. Otherwise, first we'll take a look at the grantee data. So right here, by whichever grantee you want to enter the data for, we'll go ahead and click the data button. We'll see on our Submit Grantee Data page, it'll let us know which grantee we're submitting for here at the top. And then we have a drop down for reporting period where we can select the reporting period we're reporting for. It should default to the most recent one, but you'll want to make sure you check, especially if you're doing it after the end of the reporting period and we're going back to do some corrections. It's always a good idea to make sure you're on the correct reporting period. Here you can see we have several tabs for the different items of the performance measures. So sustainability, fidelity and training, your engagement, and dissemination efforts. Once you go ahead and fill in all of the fields, down here at the bottom, we have the Save button. If there are any validation issues with what you have submitted, it'll go ahead and let you know. For example, you've missed a required field. It'll stay on that page with some red text, and some text under the fields will appear to let you know where the issue is. Otherwise, you'll be returned to the main page and you'll get that nice green message that your grantee data has been saved. Are there any questions about the grantee level data? Pretty straightforward. So we'll keep watching for questions and we'll continue to move on. So in order to get set up to submit your section level data, such as the program you're implementing's attendance, reach, and then things like your supportive services referrals, we're going to create organizations for our grantee. So we'll click the Organizations button. And here we can see I've already created 2 organizations. There's not a lot of information that you need for this. In fact, all you really need to provide is the name of the organization, so you can add that there. You can add the primary contact if that is useful for you. This is an optional field at this time. Once we've created our organization, what we'll want to do is assign program models to that organization so that when someone goes in to create a section, they know what program models they're allowed to choose from. So for example, for this organization, we see we have 1 program model assigned, and we can assign a new one by adding a program model. The dropdown will provide all of the approved options that you can select from. We'll save it, and it will be go ahead and added to our list. If you don't add the program model to this list here for this organization, when you go to create your section, this program model will not be an option to select. So we need to make sure we do this setup step first. Now that we have our program model set, the last step we're going to want to do so that we're all complete and ready is to assign our users. Here for our users, there are a few things. We can add ourselves to this list, which can be nice for documentation purposes. This is not currently a necessary step. You are still able to submit data for this organization as a grantee admin without having to add your name to this list. However, if you have an evaluator who only needs access to this organization to submit section level data or supportive services referrals, you can create an account for them by clicking the Add User button and entering their email address. Now, if they already have an account on the website, it will automatically be pulled over and added to the list. If they don't already have an account on the website, it'll ask you for a little bit more information, such as their name and phone number, and then it will create an account for them on the website. Creating that account will send them an email. It's that same email that you will get when you have your new account created. It has a link in it that expires within 24 hours that they need to click in order to log in and set their password for the first time. If for some reason they don't get that email, you should definitely let them know it's on the way, but they miss it, they're out. Maybe you did it on a Friday. When they come in on Monday, they'll simply need to use the forgot password link that is on the login page. They can use that to have a new email sent, and then that will allow them to log in and set their password for the first time. When those users log in, the only in the navigation bar, they won't see the grantees link to go to this Manage Grantees page. They will only see the organizations link that will take them to the place where they can enter their section level and supportive services data. So there are two ways to get to enter the section level data. For grantee admins, you can come through here and you'll see the sections button and the supportive services button. For organizational level users, they'll click the organizations link in the navigation bar. And then they'll select their available grantees from this dropdown. Once they've selected their grantee, once this is done loading, we'll see a list of the organizations that we have access to. If, as an organization level user, you're not seeing anything in that grantee dropdown, or you don't see any organization names appear in the table down here, you'll want to contact your grantee administrator so they can add you to the list for that organization as a user. So we'll take a look here. We'll go into sections first. We'll select our reporting period and our program model, which will give us a list of the sections that we already have and a place to create sections. We'll go ahead and click Add Section to create a new section. So we can add a name here, select some of our identifying characteristics, such as the state, setting, and urbanicity, and we'll save this section. Oop. We have an example already. Once we've created our section, the next thing we can do is we'll go in and edit our section data. And in here is where we're going to report our participants. So we have our total youth reach, which is going to be the total number of youth in that section, and then the breakdown by demographics. Each of these categories needs to total to the correct amount of total youth reach that you have indicated at the top, and you'll see that tracked in this gray box below each one. Our next tab is our Caregivers and Youth Serving Professionals tab. Again, you're going to report the reach by the total number of caregivers, and then the breakdown by race, ethnicity, and the same thing for your youth serving professionals, the total number, and then the breakdown of race, ethnicity. Dosage is going to cover the average attendance, and then how many of your participants received at least 75% of the programming. And finally, we have fidelity and quality, which asks how many sessions were planned, completed, and observed. The average fidelity of a session, as in how many activities were completed over the number of activities planned according to your program model. And finally, your average reported quality. So if you observe several sessions worth from this section, you average your quality scores and report that average here. Again, for this section data, this data is allowed. We do have the function to import this data. So if we click on the imports link in the navigation bar, what we will be able to see is down here will be an upload for the TPP 2023 grantees, and you will be able to upload the data for the section level data only. All right. We'll go ahead and take a moment here and we'll turn back to the questions to see if we have any more that need answers. Take a look. So we have a question from Sarah. I'm an external evaluator to a new grantee. Should I request access directly through the support desk, or should I go through the prime recipient or program officer? So I would say that you should go ahead and wait probably until tomorrow midday to see if you receive an email if you're expecting to have a new account created. If you're listed as an evaluator, I believe we're creating accounts for those people. If you don't have an account by midday tomorrow, then yes, go ahead and contact your project director or PO. You can email the help desk while CCing them, and we'll go ahead and create those accounts for those of you who need one but don't have one yet. Please do your best to provide the name of your grantee and especially your grantee ID number in your email request to the support desk. That really helps us figure that out much faster. So I have another question. I am on the OAHPMData.net website. I do not see my current grant. Do I need to contact OPA Data Management Team? So if by current grant you mean the 2023 grant, then those are not on there as of yet. They should be added this afternoon or early tomorrow. If you don't have it by then you can contact the support team. If you're talking about a 2020 grantee, please contact the support desk and we'll try and resolve that for you. So we have, we mentioned that evaluators will get an invitation email. Do evaluators have admin privileges? If not, is it possible to request that? So our initial wave of account creation for evaluators and directors will have the grantee admin access. You'll be grantee administrators. We are not creating any organization level accounts. That would be something that the grantee admins would do to add those users to their organizations as section level reporters. If for some reason you don't have the privileges you were expecting or wanting, you can contact the help desk and CC your PO and project director, and we'd be happy to help you get that corrected. Is there an algorithm or formula for calculating the quality score? So the quality observation sheet or the session observation sheet provides instructions about how to rate the observed session, as well as how to answer the final question, which is an overall question based on the previous questions. You'll take those answers from, I believe it's question 7, the final question, whatever number you get at the end, 1, 2, 3, 4, or 5, you'll average that with all of the observation scores. So if you did 3 observations, you'll average those 3 scores that you got, and that's the score that you will report for the quality score. We have a question from Emily. For demographics, should we equate not reported with not collected? I believe I'll see if the program office would like to help us with this response.
I'm assuming y'all are talking about some of the SOGI measures, so like gender, sexual orientation. Tara, can you remind me? I think we said to identify those as not reported, but I'm hoping you could chime in because I can't actually remember off the top of my head right now.
Yes, that's what we were saying, is that if you don't collect something, you still need to enter not reported, because we need all the totals to be internally consistent, because there are checks and balances in the system. So if you didn't collect something, you still need to just go in and put the total number of reach as not reported.
And if you all visit the supplemental guidance that we did for the performance measures, we specifically have that question there. So that way everyone can sort of revisit it and make sure that we gave that exact same. But yes, you should definitely report it as Tara mentioned, because we want the totals to add up.
Yes, and you'll see here that this is what that error might look like. You'll get that the sum of the reach does not add. So if you do have, anything outside of the categories, then you will need to put it under not reported to finish your reporting. Thank you. So another one from Emily. This is a shout out for the section data tracker tool to help guide attendance, since there are embedded formulas to do the math on participant 75% or more of the sessions, for example. So thank you. Yes, shout out to our tool. If you need any help with it, or if you want to make any adjustments to it once you have it, please feel free to do so. The section data tracker, that Excel sheet that does the calculations, is not something that you return to us. So you can do whatever you want with it. Add tabs, edit it, whatever works best for your data tracking needs. It's there that it has some reporting sheets to help you with the calculations if you want to use it. But again, this is an optional tool. We have a question from Carrie asking, is there a template to follow for the CSV upload for the section data? And the answer is yes. You'll find it here in the resources section. And here there will be a folder that is labeled something like User Guide and Tools TPP 2023. In there, you'll find the download for the user guide, as well as the template and the attendance tracker, the section data tracker tool. All right, I think that covers all the questions that we had in there. So let's take a look back here. Oh, I'm sorry, the last one. We'll just take a quick look at what the supportive services reporting looks like. Here in organizations, obviously, we'll just click the supportive services button. And you select your reporting period, and then report the total number of referrals for each type of service. This is on the organizational level, so it's per organization. All right, so it looks like we do have another question, which is how do we distinguish between sex and gender? So the sex is the biological, either assigned and the gender is the gender identity, I believe, is the full label on that one. Perhaps someone from the program office could just confirm those distinctions.
Yes, and I would just add to that I'm not sure if the person's asking how do we ask this, to make the distinction, or if they are
Mm-hmm.
asking what's the difference. So I think Zach gave the answer as to what's the difference. But in terms of if you're asking about how do you ask, I'm not sure what you're asking, but you know, there's different ways that you can elicit that information, whether it's exit tickets or surveys. Happy to talk more about that offline if you need that additional guidance.
I think the goal is that, you know, we'd like to collect as much of that information, you know, as possible. But it goes back to that question previously, where if it's not collected, it is not reported. I would say that we're not asking you to guess for any of those. So either you ask and you have the information, or you don't.
Yeah, and I think we would just defer to you all. I mean, I know there's a lot of limitations and restrictions on how you might be able to ask such questions.
Mhm.
And so, however it is allowed to ask the question, you can collect it. And then, as Tara and the folks have mentioned already, anything that is not collected, you would just report as not reported.
Mhm. All right.
Yeah, and I'll just add to that. I think a lot of times in the past, you know, people ask questions that basically are asking the respondent how they identify, and it's in tradition and traditionally on surveys, surveys have used binaries historically, and so, you know, if that's all you can collect, then, you know, you use your judgment as to whether you're reporting that as the sex or the gender. And like I said, if there's specifics that you want to talk to more thoroughly about your specific case, then, you can certainly talk to your project officer and or me about that offline.
And I'd probably say probably something similar for a question about the variable names or the categories and how those are all sorted out. Please reach out directly to your project officer to speak to those. All right. So we were just taking a look at the website. We talked about a few things. So we talked about the imports briefly. Those materials, you know, if you want to see what the process is and the validation checks that you want to make sure when you make your CSV file to upload, those are all documented in the user guide. So you can take a look. There's a lot of columns, obviously, because of all the different demographic categories like age, grade, and the adults also have the demographic categories as well. So it's a pretty long CSV. So you'll want to make sure you have kind of a robust process for making sure that data is all entered correctly in that way, if you're choosing that route. The resources are available, again, the user guide for download, the section data tracker / attendance tracker, and then the template for the CSV upload. Basically, it just has the names of the columns, the header columns is the template. We have our tutorials playlist. So each webinar so far, as well as several tutorial videos, are available in a playlist on YouTube. In our tutorial in the navigation bar, the tutorials link will just go ahead and open a tab for you to that playlist. And that's also where we'll be posting the recording of this webinar if you want to go back and review any of the content here. Finally, on the far right, you've got your user profile. This is where you can update your password. If you need to change your multi-factor authentication from your phone to a different phone number or a different option, that's available there. The one thing that I think I haven't mentioned yet, 2 items here, is going to be number 1 is the data extract. So that is currently available. Any data that you put in, grantee and section level, if you pull that extract, you'll go ahead and get all, let's say you're associated with 2 or 3 grantees that are TPP 2023s. You'll get all the data for all 3 of those grantees. Each extract is by like cohort year. So if you're new, you don't have to worry about it. And if you're a TPP 2020 coming back, you'll be able to still get that data and separately get the new TPP 2023 data extracted. It comes out in a zip file as multiple CSVs that should contain everything that you need. Later on, I believe by the end of January, you'll be seeing actual reports, which will be tables of summaries of the data that you've entered. There'll be some kind of basic functionality there, and then a few months down the road later, there will be some nicer dashboards to help you kind of track some of your items in a more visual way as you're reviewing the data that you've entered. The technical assistance help desk for OAHPM data support, we are here. Please, the best way to get in touch with us is through email. You can send us an email and it goes out to the members of the team on duty for that day, so we can respond to you as quickly as possible. For the phone line, you are able to leave a message, but unfortunately we are not able to actually man that phone line and answer the phone, so it will be a message. We will get back to you as soon as we can for the phone messages as well. But the fastest way to fully explain your problem is usually an email providing details if you're having trouble logging in, things like your browser or your operating system. Those things will really speed us up and able to identify where the issue might be if it's something along those lines of a technical nature. All right. So we have our final kind of questions section here. I want to thank everyone for sitting through and listening to all of that. I know it's a lot of information to take in, and maybe some of you have heard a lot of this before. It's very similar to the previous cohort as well. I'll turn it back over to OPA in case they have anything else they want to say.
Yeah, this is Tara Rice, and I just want to thank everybody for taking the time to listen to this demo. We still have a little bit more time if anyone has any other questions. Jacqueline, is there anything else you want to say?
No, thank you for walking through the performance measures database. I'm actually really happy we separated it from the performance measures conversation, because that way the questions can be focused on the website and the use of the website themselves. So this was super helpful. But yeah, any questions that folks have, feel free to let us know.
All right, then. We'll go ahead and stay on the line for a few minutes here until we see most everybody drop off. But that is the end of our planned presentation. We'll just stick around to answer any final questions. Thank you all. I hope you have a wonderful week for those of you leaving. And again, we'll be here for just a few more minutes if there is any final questions.
Thank you, Zach.
Yes, I'm sorry. The recording will be available on YouTube through the tutorials link, and the slides and other materials will be posted.
I believe on Connect, Zach.
On Connect. Thank you. Sorry, I was like max.gov and then I wasn't sure, so Connect.
Yeah, Max turned into Connect very recently.
All right, we have a question from Camille in and out of the office, so hopefully I haven't missed this. Do we have the MIP, PM, and SAPR due in January? I seem to be missing the due date on the monitoring and improvement plan.
That's a really timely question, because I just saw an email about it, and that is due February 29th, the MIP plan. We'll make sure to maybe put something to make it more obvious for folks.
Ooh, okay, interesting. From Therese, when inquiring about gender identity or sexual orientation, should that be asked by the evaluator or the program staff at EVP sessions?
So I think the short answer to this is, you know, you could do this either way. I mean, there are projects that collect demographic information on participants through the evaluator as part of, like, say, pre-post test or something like that. There are other projects that don't have a formal evaluation going on, and so they have project staff who are collecting those questions. So I think the answer that I'm going to say is that it's going to depend on how your project is structured. And I do think it's important to make sure that whoever is asking the questions is asking the questions in a way that is protects the confidentiality and the privacy of the participant. Jacqueline, is there anything you'd like to add to that?
No, that was super helpful. I mean, I would just say we're asking you to do your best that you can to collect this information. We've talked before in previous webinars about how helpful it is for you all to have that information, right? Like, if you're supposed to be implementing with Latina females, then you want to make sure that the data of what you're getting back from implementation is that target population. But, you do the best that you can with, as Zach mentioned, without guessing. So whatever works best for you all. And Treese, I would propose that you can send that question in the listserv and see how other folks might collect this information. That way you could crowdsource some ideas.
Right. That's an excellent idea. As always, other grantees are an amazing resource because there are grantees that have been collecting this information for a few years, and they can definitely provide some input.
Just to add, we have an I did from Treese.
All right, Treese, then I might have to lift up that question for you again.
Okay. So we have another new question from Caroline about supportive services. I want to confirm that checking off referral services doesn't indicate linkage to care, or that orgs don't need to confirm participants engaged in a service they were provided referral info for.
Sorry, Zach, can you ask that question one more time?
Yes, I want to confirm that checking off referral services does not indicate linkage to care. So orgs don't need to confirm participants engaged in a service they were provided a referral to.
Oh, yeah. So if you are for supportive services, when you're and Tara, please correct me if I'm wrong. If you're identifying, like you're saying, for example, 5 youth for healthcare services, you're saying that you referred that person. But when you're saying you referred that person, it's an active referral. It's not just I provided them with a guide that had a bunch of information that included healthcare services. It is somebody came up to you, they asked, hey, I need to go see somebody. Can you provide me information? And that information was provided to somebody.
And that's where it ends.
Yes.
And you do not need to confirm that they have followed up.
Correct. There's no requirement in the performance measures or with our grant that that person actually received the services that you referred them for.
Right. Perfect.
All right. I haven't seen any new questions come in a bit, but there are still a handful of people here. So we'll keep sitting here since we've been scheduled until 3:30. But again, thank you all. If you have other things you want to get to, we're just waiting for more questions to come in if there are any. If you feel like you might miss out, the whole end of the session will be included in the recording, and you're welcome to come back and check later, as well as there will be a transcript available. All right. with that pause, I'm not seeing any new questions come in, just some thanks. You're welcome. Hopefully this was helpful for everyone. Oh, okay. We do have a fresh question. All right, so this is from Bethany. Could you clarify planned versus completed for the sessions and how that should be counted? I'm wondering if there's an hour-long lesson or session and all activities but the last one is completed, would that be considered planned or completed? Is there a threshold? So the number of sessions planned, completed, and observed, you should know what the number of sessions planned is beforehand. So let's say that you plan an hour-long session. Either you did that session or you didn't. If that session was long enough to be counted as you did it, then great. If it was so short, like you got 2 minutes into it and the fire alarm went, I might not count that one. That's separate from the number of activities planned and completed within a single session. So you might have 8 sessions planned, and in session 2, you plan to do a worksheet, a discussion, and then, some kind of homework that you send home or something. That would be 3 activities. And if you only get to 2 out of those 3, you still completed that session, but you only did 2 out of the 3 activities, which would be part of your fidelity score for that session and that section as a whole. Okay, good. That seems to have answered the question. Are pre-post tests required before EBP sessions? From Trace.
I'll start, and then Tara, you can add on. Pre-post is not required per the Tier 1 grants. We do encourage you to think about how you can, monitor your project for a whole host of things. So please visit the Monitor and Improve plan guidance to sort of think about that. But there's no requirement for a pre-post in the EBP implementation.
Yes, that's correct. I agree with what Jacqueline just said. We do know that some people do it. So, that's why I brought it up as a way to collect that some people collect their demographic information, but it's not actually a requirement for Tier 1.
All right, I'm finishing up documenting the answers to all these questions here. Let's see if there's any new ones. None yet. Oh, here's one that it looks like we may have missed, but we can answer it now just for documentation. Since the other category was removed for referrals, what do we do if a referral that is not in those categories? Do we not add that referral?
Yeah, so it wouldn't get counted in this through the performance measures website. I would recommend adding that information into your semi-annual POX report narrative. Oh, sorry for all that sound in the background. I would recommend adding it in your performance measures as additional information and services that you're offering.
And that's the SAPR? What are you talking about?
Yes, the SAPR is the semi-annual POX report.
Okay, so add details in SAPR. Let's see, we still have a few attendees here, so we'll just check the end of the questions again. No new questions thus far. Okay, well that's going to be all of the questions answered in the questions module. So if anybody needs to review any of those, all those answers have been typed in there. I do not see any further new questions appearing, and it has been a few minutes, and we only have a few minutes left. So at this point, we'll go ahead and say that we're going to end our broadcast at this time. Thank you all for sticking with us to the very end. I hope you have a wonderful rest of your week. Any final words that we'd like to share before we go?
I would say thank you, Zach, because I think that was super helpful to walk through this system, and you do it with such care and patience, so we appreciate it.
Seconding that. Thank you, Zach. This was great.
Thank you. I really appreciate that feedback. All right, everyone. We'll have a wonderful day, and I'll go ahead and click the stop button.